All right, let's get right into it. If you're building a career in psychiatric mental health nursing, you absolutely have to start with an unshakable foundation. You just can't build a safe, effective practice on shaky ground. So in this explainer, we're going to lay down that exact foundation, giving you the blueprint, the tools, and the core principles that you've got to know.
So I want to start with a question for you. What do you think is the single most important tool you have in your toolkit? And I'll give you a hint. It's not a stethoscope, it's not a particular medication, and it's not a diagnostic manual. It is something way more fundamental, and we're about to build it together, piece by piece.
So here's our game plan. First, we're going to start with the blueprint itself, the therapeutic relationship. Then, we'll grab our tools, the art of communication. After that, we'll zoom in on understanding the person, looking at how we all cope and defend ourselves. And finally, we'll pull back and look at the bigger picture, the legal and therapeutic environments where all this incredible work happens.
Okay, part one, the blueprint. And listen, I really can't say this enough. The therapeutic nurse-client relationship is the absolute bedrock of everything we do. Seriously, every successful intervention, every bit of progress, all the healing, it all starts right here, with the connection you build.
So what's the whole point of this relationship? Well, the goal is not to fix somebody. The goal is to be their guide, to empower them. It's all about helping the client develop their own problem-solving skills and their own coping mechanisms. You're basically helping them build their personal toolkit for resilience.
So, how do we build this thing? Well, it all starts with these core principles. You have to be genuine, respectful, and empathetic. That's non-negotiable. You have to provide holistic care, which means you're looking at the whole person, mind and body, not just a diagnosis. And all of this is built on a foundation of honest communication, really clear boundaries, and, of course, strict confidentiality. When you put all those pieces together, you get the magic ingredient: trust.
You know, this relationship doesn't just happen by accident. It actually develops through four pretty distinct phases. The first is the pre-interaction phase. This is your homework, right? This is where you check your own biases before you even walk into the room. Then you move to the orientation phase. You meet, you start building that trust, and you establish a contract, which is just an agreement on what you'll be working on together. Next is the working phase. This is where the real deep dive, the problem solving happens. And finally, you have the termination phase, where you look back at the progress and you prepare for a healthy goodbye. Every single phase is critical.
Okay, let's move on to our second section, the tools. So if the relationship is our blueprint, then effective communication techniques are the power tools we're going to use to actually build it. What I love about this slide is how clearly it lays out the do this, not that of communication. On the left, you've got your therapeutic tools. Things like open-ended questions. They literally open up the conversation. Now contrast that with asking a million questions in a row, which just feels like an interrogation. Or look at the difference between restating what someone said to show you're really listening versus offering false reassurance like, oh, don't worry, everything will be fine. That can actually make someone feel like their concerns are being dismissed. Mastering the stuff on the left is a total game changer.
Okay, so we've got our blueprint and our tools. Now we need to really understand the person we're working with. And a huge part of that is understanding how they handle anxiety, that feeling that's so often at the heart of mental health challenges. And this is where coping and defense mechanisms come right into the picture.
So what even is a defense mechanism? Well, at its core, you can think of it as a protective shield. It's an automatic, usually unconscious, strategy that our mind uses to protect our sense of self, our ego, from feeling totally overwhelmed by anxiety. And they're not really good or bad. They're just functional. They serve a purpose.
Let's look at a really common one, rationalization. This is when we try to make feelings or behaviors that we know are kind of unacceptable sound totally acceptable by coming up with a really good justification for them. We're basically making excuses to make ourselves feel better. And this is a perfect example. A student fails an exam. The feeling that's really hard to accept is, I failed. To shield themselves from that anxiety, they rationalize it. Well, the lectures were just terrible. See how it shifts the blame? It protects their ego and makes the situation feel more manageable.
Okay, here's another big one you'll see. Regression. This is when a person, under stress, goes back to an earlier stage of development. It's like they're hitting rewind and reverting to an older, maybe more childlike way of behaving to cope with something that feels too big to handle right now.
This is such a classic example, right? A new baby comes home, and that's a huge source of stress and anxiety for a little kid. So what happens? They regress to a behavior from an earlier time.
a time when maybe they got more direct, undivided attention from their parents. It's a completely unconscious way of trying to manage these huge, overwhelming feelings.
Now, here is the most important part for us as nurses. You never just rip a defense mechanism away from someone. That's like taking away their shield in the middle of a battle. Your job is to first help them figure out where the anxiety is coming from. Then you work with them to build new, healthier coping strategies. Only when they have a better tool in their hand can they start to let go of the old one. And that takes a really supportive, non-judgmental approach.
All right, for our last section, let's zoom the camera all the way out. We've talked about the one-on-one relationship, but where does all this care actually happen? The environment, both the legal framework and the therapeutic setting, is a huge piece of this puzzle.
One of the biggest distinctions you have to know for any exam is the difference between voluntary and involuntary admission. Voluntary is pretty straightforward. A client knows they need help and they seek it out themselves. They keep their civil rights and can ask to leave. Involuntary admission, on the other hand, happens when a person is considered a danger to themselves or others. It's a legal process, but, and this is so important, the client still keeps most of their rights, including the right to refuse treatment if it's not an immediate emergency.
And that brings us to a closer look at these rights. You know, a person doesn't lose their basic human and legal rights just because they're getting mental health care. This slide lists some of the most critical ones, like the right to refuse treatment and the right to confidentiality under HIPAA. And a really key principle that guides everything is the right to be treated in the least restrictive setting possible that still keeps them safe.
And finally, let's talk about the therapeutic environment itself. You'll often hear this called milieu therapy. The idea is simple, but it's so powerful. The environment is the treatment. Every single interaction, every activity, the whole daily routine, it's all structured to be therapeutic. The #1 priority is and always will be safety. And the ultimate focus is to empower clients by getting them involved in setting their own goals.
So we've gone through the blueprint, the tools, the person, and the environment. We have laid the entire foundation. And that brings us right back to where we started, but now with a really clear path forward. So now that you have this blueprint, what is the very first step you're going to take to build that all-important trust?